Well, everyone, welcome to this webinar. We're so excited that you joined us today. This is a webinar on Turnkey Revenue Cycle Solutions for the 21st century and how the digital patient experience can improve revenue. I say it does improve revenue. I'm really excited to dive into that and see how it works. So if you want to go to the next slide, Lisa. My name is Jeff Johnson. I'm the Chief Client Officer for Professional, which includes Professional Credit and Ensource. I'm one of your hosts today.
And I'm Lisa Kirk. I'm the Vice President of Sales, and I'll be your other host today. And then I'm going to introduce you to Brenda. She has graciously joined us today from Minidoka Medical Center. So Brenda, would you like to introduce yourself and a little bit about Minidoka?
Sure. Hi, everybody. My name's Brenda Ward. I'm a registered nurse and the practice manager of Minidoka Medical Center. We're a provider-based rural health clinic in Rupert, Idaho, which is in south central Idaho. We've got 14 providers in 3 locations within our provider clinics. And as part of Minidoka Hospital, we've been serving Minidoka County since about 1960. We're really focused on trying to provide affordable care to our people close to home, expanding and developing services and technology wherever we can.
Great. Thanks, Brenda. And then Tammy, have you introduced yourself also?
Perfect. So I'm Tammy Kuhn. I am the Vice President of Business Development and Operations for Ensource. I've been with the company for 19 years and have over 35 years of experience in customer service and collections, including the revenue cycle. And I am currently the president of Oregon HFMA.
Mm-hmm.
Welcome,
Thank you,
Tammy. Yeah. Well, we're so excited. We know that there are a lot of challenges in healthcare everywhere we go. It's in a constant state of flux. And there have been many challenges, obviously, Brenda, that Minidoka has also been faced with. So we're excited to jump into this. And maybe you can tell us a little bit more about some of the challenges that you were facing that brought you down this path that you're on today.
Thank you, Jeffrey. As I said, we're a small provider-based clinic in a small rural town. We have a separate EMR than our hospital has, so we're kind of a standalone system. It's kind of a little nondescript EMR that doesn't have a lot of forward-facing technology. There's no payment portal. There's really not very much of a patient portal at all. Our access to collections agencies in our area was very limited, very small companies with very small spreadsheets, didn't really have up-to-date availability for reports for us to even try to balance our bottom line. So we were looking for someone who could give us the technology that we needed for our patients to reach out to us, to more easily pay their money, also helping us to offload some of the day-to-day work of the revenue cycle. So we didn't have to hire additional staff, someone that would help us with, when I say collections, I don't mean just collections, but day-to-day accounts receivable, and then rolling into a more sophisticated collections cycle also. Our collections had sat in this antiquated agency. When we finally pulled them back, they'd been there 7, 8, 9 years with no activity. And so we're really looking for somebody more proactive to help us get our money.
And Brenda, you had tried other systems for payment portals and that type of thing. Maybe you want to talk about that challenge.
Yes, with our EMR vendor, they had third-party associates that they said integrated with our system that offered payment portal, payment record, keeping technology and all of that. But it was really cumbersome. It was extremely expensive. Not good return on the investment at all. Patients didn't like it. They didn't utilize the payment portal, and they didn't like the technology that was being offered. We were told that, well, if all you want is a payment portal, you can get an app for that. But trying to figure out how to integrate that with our revenue cycle, with our technology balancing, our spreadsheets and everything, we just couldn't even consider that.
So there's things you can go and get on your own and build on your own, or there's very expensive things. And like most critical access or rural healthcare providers, you have some budget constraints. And
yes.
How important,
go ahead.
How important was it, Brenda, for like your payment gateway? Did you run into any restrictions with vendors being able to bridge the payment gateway into your guys' gateway?
Yes, we did. With this one vendor that we utilized, we probably used them for over a year. It was really cumbersome. We had a lot of trouble getting the payments to transmit over. It actually created extra work for us instead of saving time. It wasn't well received by the patients either, so it just didn't work out.
Yeah, that's very important, I think, for payment portals today is really being able to have that custom bridge into the provider's gateway, payment gateway, so that you're not taking on that additional work.
Yeah.
Great. Thanks, Brenda. And not only did you have your own internal challenges, you also had some regulatory challenges. So in 2021, it was pushed back a little bit, but January 1st, 2021, the Idaho Patient Act went into effect with a number of additional guidelines that you had to abide by in order to perform extraordinary collection actions on an account. So you had your consolidated summary of services, which was a new letter that has to go out to patients stating who might have provided services to the patient. You had to bill accounts within 45 days of the visit. You couldn't do any extraordinary collection actions within the first 60 days. And then each of the statements had to have additional information about any insurance payments or credits or adjustments that were made to the patient account. So a lot more work from your team. And so that itself created some challenges. I don't know if you want to talk about some of the statement challenges or other internal challenges that you were not looking forward to with that.
Well, aside from the tremendous workload that this puts on our billing department, trying to keep all of these CSS reports done and sent out in a timely manner. In addition to that, between our electronic medical record and our statement vendor, we couldn't get the required information put on the statements. Patient demographics needed to be more complete and more charge detail than what we could get them to put on there, at least in the months we spent working on it.
And so the Idaho Patient Act is obviously just for Idaho, but our team at Professional has seen a lot of additional regulation that's gone in just in the last 6 months to a year. Regulation F is a federal one that applies to the collection industry. Our early out isn't directly affected by that, but most certainly things that they do, and if it rolls to collections are. So we know there are both state and federal regulations that are impacting all healthcare providers and how they're able to collect on accounts. So
So Lisa and Brenda, thank you so much for talking about those regulations. They're out there in abundance, aren't they? Hitting healthcare systems in every state, and at least, as you mentioned, nationally as well. I know that some of the solutions that can come into play are due to business partners that are out there that can help ease the burden that is out there, especially when you're stuck with so much additional work that comes from some of those laws and regulations. Brenda, also thank you for sharing just the challenges that you were facing. I don't think that you're alone in what you're doing. So it's nice that you're stepping out and sharing your story. And with that, let's talk about the solution that came up as well.
So our one vendor solution at Professional, where we have both Ensource, which is an early out patient recovery program, and we also provide patient statements at Ensource, and then Professional Credit, which does our debt collection side of the work. Both create a omni-channel approach when it comes to speaking with the consumer. So we've put a lot of investment into technology and being able to meet the consumer in the channel that they prefer. So whether that's traditional phone or mail, or maybe they want to go onto the portal or use text messaging, we have all of these different ways that we are able to communicate with the patient so that we are providing the highest recovery for our healthcare clients. We also have behavioral science that's going into place when we speak with a responsible party or when they're engaging with our portal online. One thing that I know Brenda mentioned was important was the white label portal. So having a place where that patient could go on, it looks like they're going on to the Minidoka Medical Center payment portal. It's actually managed though by Ensource. We work together very closely with Brenda to get it set up to meet the specifications that Minidoka needed. They can go on, they can manage their account 24/7 and pay their bill to the clinic the way that people pay most of their bills now, which is online. Mm-hmm. And we also have our revenue cycle consulting arm. So we're able to really guide our clients as they're going through the decision-making process of how do I want to implement this program? What are the things that I should consider? What are the things that I don't know? And Tammy, maybe you want to talk a little bit about some of the best practices that we can guide clients through.
Yeah, I mean, it is great because all during that implementation process, we're looking at, what is best practice? Is it statements? How you want to roll those statements out? Do you want to do them daily or monthly? Do you want to turn accounts at day 1 or at day 30? And so we share that during the implementation. We kind of go over the best practice of what we've seen, and we try to guide, make those decisions and say, hey, here's best practice. Ultimately, it is up to the provider on what practices they want, but we do, because we've worked so hand in hand with so many providers, we give those best practices to say, this is what we found that works best. And so you've always got that consulting that we can work with our providers.
Right. And in addition to that, Tammy, we really appreciated how you worked with our company on customized, personalized scripting so that we were able to reduce or eliminate the apprehension that we might have in our clientele, strangers reaching out to them about their money. We didn't want it to be the least bit aggressive feeling to them. The minute they think they're getting a call from a financial company, they're afraid it's punitive. And so we appreciate the work you did with us up front, educating our patients and scripting everything carefully to meet our needs.
And one thing, that one vendor approach to make a change to your early out, to create a white label portal and change your debt collections vendor, that can be a big burden on your team, right? And so the nice thing about having one vendor that can resolve all of these challenge areas for you is that it's one meeting. We set up one meeting a week for the implementation period, and we're able to address all of those things rather than multiple meetings with multiple different vendors. So with that revenue cycle best practices that Tammy talked about, it was identified that statements were an area that Brenda wanted us to work on, and with the Idaho Patient Act, having all of these new regulations that we're going to need to go onto the statements, we identified with Brenda that, their current vendor was not going to be able to provide these services with the current file transfer that was coming from their EMR. So Tammy and her team was able to come together, create a new statement with a new look and feel, and this is what it looks like with all of those regulations from the Idaho Patient Act. So it's able to meet those needs and didn't have that additional burden for Brenda and the Minidoka team to implement. We also found that having the same statement for 15 plus years and then changing the look and feel could make people a little nervous. So Brenda asked, do you have any marketing that we could share with them to let the patients know that this change is coming? So we created this flyer. And then Brenda, maybe you want to talk about how this was shared with your patients?
We posted it in the waiting room. We put it on some little holders at the reception desk, and we also posted it on social media.
And Tammy, I know Brenda and you were talking before this meeting that patient complaints were very low, if any, with this change.
Absolutely.
Yeah, I think with all the changes that, Minidoka did, there was just very few questions. So it was very well received. It was out there where the patients knew the new statement was coming, and they knew that, we would be contacting them. And so just very, great acceptance for the community, and very low complaints.
Mm-hmm.
Awesome.
Because they knew what to expect. So great job in marketing that, Brenda, getting that out to your consumers.
Thank you. Your team on the phone calls has received good reviews also from our patients. There was a little concern in the beginning, but just the first few phone calls, and we haven't had a single complaint about the customer service. The communication back and forth with our team to your team on insurance changes and all of that has been outstanding and seamless. Your portal access for us, I don't know if we've talked about that yet, but the portal that we can log on to review what you guys are, no, our Ensource portal that we log into for the tools and everything is outstanding. So a lot of good communication back to us from your team.
Yeah, that communication is key.
Yeah.
Well, and as you mentioned, Brenda, one of the big things when you selected Ensource to work your early out business was the ability to have an online payment portal. That was something that Ensource did, or that Minidoka did not have previously. And so this is just a screenshot of what that portal looks like. Again, this is all managed by Ensource, but it looks like it's Minidoka's. And so a seamless look and feel for that patient when they go on and manage their account.
Now, it's my understanding that there wasn't just one portal created for Minidoka. Is that correct? There were multiple, showing that the white label portal can be very flexible even within an organization. Mm-hmm. Is that correct?
Yes.
Awesome.
So Brenda has 3 locations. She's got the rural health clinic and then the ENT and the surgery and specialty clinics. And it was important to Minidoka to be able to keep those separate. So Tammy and her team were able to create different portals for the patients so that they knew which account that they were managing. It makes it very clear, but also very straightforward for the patient. So they know exactly which account they're paying on, and that user interaction is the same for all of those experiences. So it's not a different portal if they go to surgery and specialty compared to the rural health clinic. It's the same experience for a different location. Mm-hmm. And then when they log in, this is what it looks like. And Brenda worked very closely with Tammy to say, how do we want to roll this out? What do we need to have on here? What's our payment parameters? And so again, this is set up to meet the needs of the clinic. So the patient can log on, view their account, view electronic statements. They can chat with the Ensource team, who again is acting as an extension of Minidoka. And they can manage that account right here real time. And not have to pick up the phone. And we found this technology so important. Patients want to communicate this way. People don't want to pick up the phone. They don't have time to pick up the phone and talk to somebody. They want to do this in the 5 minutes that they have. And so it's so important for Brenda, you and your team, to have this option for those folks who need it.
Right.
Sorry.
No, go ahead, Tammy. Sorry.
It's also very important to have that customization, for the provider to be able to, have the payment parameters that they want, how they log on, because patients are used to that. So, it's great to have those match what the provider wants.
Right.
It's not one size fits all.
Right. I was going to mention that if at any time your customer service reps aren't able to answer the question or meet the needs, the calls are certainly referred back to us for further detail handling. So we appreciate that too. Still keeps our hometown experience going that way.
So important.
Yeah.
So the approach, this is something that, Brenda, I know you felt was really important, is to have a vendor partner who was an extension of Minidoka's values, and working with any critical access or rural health community. It's so important to behave in the way that your staff would. And we want to treat everyone with the highest level of dignity and respect. And that really aligns well with Ensource and professional credit in our New Deal approach. And that is really a focus on empathetic communications. We are making sure we're communicating with the right patient at the right time with the right channel. So we look at how is this person responding to our phone calls, to our printed statements, to the electronic communication through the portal and text messaging. Does this person really respond better when they get a notification that they have a portal they can log into and view their account? Or is this somebody who responds better to the phone? And we have our behavioral scientists really working on the scripting that receives the best results from those customer service agents. And we're getting that out to the rest of the team so that we're using the same scripting. And we want to make sure that we are treating patients in a way that's not going to create complaints, because we know that everyone in your business office is probably familiar with at least the names, if not the faces, of the people who they see. And so they know that, John Smith doesn't work in the business office. So having that clear communication about who Ensource is and, what that relationship looks like. Do you want to talk a little bit about the communication that you've had with your patients and how that's gone?
As I said, your team has been very well received. A little surprised at first that it was, outside numbers. People are a little suspicious about that, but everything's been handled in a very kind and caring and compassionate way, not the least bit assertive or aggressive. And we've had nothing but positive feedback once they get over the suspicion of the strange phone number.
And Tammy, maybe you want to talk a little bit about how you make sure your team aligns with each healthcare provider that you partner with. What does that onboarding look like internally to make sure that we are an extension of the healthcare providers that we work with?
Yeah, so we work in detail with our team to really look at what their mission, vision, and value is, and so that they understand their demographics, where they're at. We do provide that custom scripting for that team, and they need to understand that, in a smaller community, everybody knows everybody. And so, they have to understand all of the policies and procedures that go with, with that provider. So it's not just a fast collection. It is, we are you, and we follow your same procedures that you would. Mm-hmm. And so there's a lot of training that goes into the customer service representatives, mm-hmm. With that. And so it's a work in progress. And, we like to think of ourselves as a true partner, not a vendor. And so, being a partner, we need to understand everything that, that the team at Minidoka would understand.
Definitely. That's awesome. I really love the complete solution that's been shared. Thank you guys so much for walking us through that. And I have to believe that through this process, we talk about best practices and wanting to get the best out of everything. I'm sure there's some great takeaways that have been learned through the process and some things that we should share with others that are considering doing the same. Lisa, would you like to lead us through those?
Sure. So as far as the takeaways go, we've got the main things that we think are important if you're looking to make a change. And the first one is to create the goals. So develop a framework for performance that can be followed. Tammy, do you want to talk about some of the goals that we've outlined?
Yeah. So like when you look at your, goals, what do you want on your online portal? Do you want to accept payments? Do you want to do checks? Do you want to do credit cards? Do you want electronic statements? Do you need multiple locations? Set those goals of what your portal needs and what your guidelines are. And again, it's completely customizable. So know upfront what those goals are and, what you want to be able to provide for your patients.
And in addition to the goals of that online portal, I think, what do you want out of a one vendor solution? Does it make sense to have an early out debt collections, white label portal, revenue cycle solutions? Is it one or is it all of those things? And how do they work together? Do you want accounts to roll that don't pay to a collection agency so that you don't have to handle that? That's just, off your books, you see which ones go, but you're not having to do the manual work. And setting up parameters for if payment plans are set up outside of that portal, what are those guidelines to follow, right?
Yeah, it really comes down to that, when you're setting those goals, it's really working with that, with your partner to say, what's best practice really, and kind of got, working together to say, best practice looks like this. This is what we've seen. And so it's, know what your goals are, but really, that consulting piece is key throughout this entire process to say, what is the best program that I can do for my community?
And I'll add, as we go through this, what these goals come from what we have learned over implementing a number of these projects with rural health clinics and critical access facilities. Knowing these things in advance can really speed up the amount of time it takes to go live. There are obviously outside challenges that can make that slower, but we found that creating goals, establishing a timeline, identifying challenges, and understanding limitations are the key things to make sure that you have a seamless implementation. So the next one is establishing a timeline. Know when you want to send accounts to early out. So Tammy, you want to talk about the timeline piece?
Yeah. So, we found best practices as day one, and look at when your statements are going out, when, we look at when phone calls are coming in, so knowing what the timeline, the mails for the statements to come in, when you start making those phone calls, and really, looking at that best practice is day one and making sure the statements are going out timely and we're following all those processes, I would say an average would be, a timeline of saying is you could, onboard within about 60 days, providing you don't have external limitations or other challenges. And we'll talk about that a little bit later on. But, our goal is to always, get our providers up and going, within that 60 days. And it does take time when you're looking at statements, because statements do take time, to looking at that, making sure that you checked all your compliances and, there's no regulations that we haven't gotten, and getting them all mocked up and ready to go. And that does take some time.
Well, and Tammy, just to piggyback on what you said about when to send accounts to early out, I think so much of that decision is knowing what you want from the early out partner, right? So do you want them to do statements? Are they acting as an extension of you where Ensource is using your hospital or clinic's name and figuring out what does that program look like? And if there are statements involved, day one makes a lot more sense because then you don't have a change in what that statement looks like when it goes to the early out. And it's also with this timeline piece, this is where our revenue cycle consulting can come in really help really handy because we've got this experience and we have implemented this at a number of locations and can say, well, here are the benefits of referring at day one versus day 30 or another time frame. So
there's always pieces that that you need to know about. It's like, for payment plans, how long do you want to take them out? How do you want to handle a dispute? How do you want to handle a bankruptcy? How do you want to, there's so many little pieces that goes into this implementation that you need to make sure that you cover to have a seamless integration.
And the next thing that we talked about is the challenges. We don't always know the regulatory challenges that are going to be coming for us, but a lot of them we know about ahead of time and can be prepared for that. But knowing the impact that they're going to have on your team internally and saying, hey, there's no way I can take that on internally. I'm going to need a vendor partner to help with that. Having that information in advance is very helpful. And that's something that professional can really be helpful with. We're licensed in all 50 states. We have an internal team of compliance attorneys who are very aware of all of these new regulations and keeping us in the loop on those changes that are coming. So having a vendor partner who is focused just in the patient collection space can be very helpful so that you guys can focus on the patient aspect of it. The next piece is just understanding limitations. And I think this is the area we have the most to add here. And I know, Brenda, with your system, there were some unique challenges, but I think all of us, if you're working at a critical access or rural clinic, you need to understand what are the limitations of your system. And a lot of times, until you try to implement one of these programs, you may not know. So Brenda, you want to talk a little bit about some of your limitations and things you learned throughout this?
One of our biggest obstacles in our implementation was getting the financial reporting out of our EMR correctly in a stable manner to go to you guys for no matter what format we could send it to you, whether it be PDF or Excel. Dan was able to digest it, rearrange it, and with a lot of back and forth over a month or so, we finally got it decided on and stabilized. We had to have some custom work done on the backside of our EMR, but it was very affordable and very quick, very efficient. So that was the biggest limitation for us, I think.
Well, and then there are also, besides the technical limitations of the system that you might be operating on, is budget constraints, and then internal resources. What are the resources that are going to be strained, at least through the implementation period, maybe a little bit longer until that is taken off? And then what is the resource availability to work on other things once this has gone through the implementation period? Right.
We started looking at early outs over a year ago when it was September of 2020, when we were recruiting our ENT doctor. The decision was made, okay, what are we going to internalize for our processes rather than duplicating staff here and there? So we took on the coding and we took on the billing. And rather than hiring additional people to try and handle the additional workload, our CFO and CEO agreed that we could explore early outs, and your company came highly recommended. And we were doing this in an effort to not have to hire more people. We've always worked really tight, really lean, and we didn't want to hire additional staff. I don't have a place for them to sit. So it's really nice that you provide all the seating you need for your people, and I don't have to do it here.
I love that it's a physical limitation, not just a
budgetary one. It was definitely a tipping point for us. Standing room only now.
Well, and one thing that we found was that there were some marketing limitations as well, that Ensource was able to assist with so that we could promote and make sure that patients were aware of these changes. You didn't have the internal resource to share with the community that this was a change that was coming. And I know beyond the statement, we also had some verbiage just to let the patients know that this change is coming and make people aware so that they're not caught off guard. Everyone, it's going to be a change. So with changes come some challenges, but
Yeah.
I think just knowing,
Sorry, your best practices also with the changes we needed to make to our consent forms for the electronic communication was very helpful. We would have never been able to come up with that. So that was very helpful to us.
Awesome.
Yeah. And what Brenda's referring to is in order for us to use text messaging or communicate via cell phone, the consent from the healthcare provider has to establish that. And so we were able to send Brenda some best practices and preferred language so that they could easily make that change in their consent document. Anything else to add on this slide?
It's great information.
I was going to mention that it's good that everybody understands what your ultimate goal is, but just remember it's a transition in progress. And, every week when we meet with you guys, it gets a little bit better. But it's not like you turn on the switch and you're done touching your accounts. There's a lot of back and forth, but it's been very pleasant. You guys have the most streamlined, efficient implementation process I've ever gone through. So definitely appreciated your expertise.
Thanks.
That's great to hear. Thank you, Brenda.
Thank you.
So we wanted to open up for any questions that you might have. We have a chat feature in Zoom that you can submit questions to us. So we'll give you a couple moments to submit those questions. We've got Brenda here. She's a great resource. We went live not that long ago, Brenda. We wanted to do this while it was fresh in her mind. How long have we been live with?
3 months now.
Okay. So, a lot of these things are still fresh in Brenda's mind. Typically after we go live, it's about the first 90 days that we continue the weekly meetings. We're about to taper those off. I think we've got to a fairly steady state cadence, and those will taper off. So if you've got any burning questions about this program, or why did Minidoka choose this one vendor turnkey solution, she's here. It'd be great to ask her yourself.
So Brenda, I know that when we were talking before, you were just talking about the ability to still, though these were solutions being offered through professional, you were still able to have complete customization and a lot of say in the way that things were implemented. And how big has that been for you as far as a comfort level goes?
Well, comfort level, because you're involved in every little nuance of the implementation. You're confident that it's going to work, and we were confident that it was going to be handled professionally and in a friendly manner with our patients. The technology is outstanding that Ensource and Professional provide to us, the technology coming back at us, not just for the patients, but the technology coming back at us has been outstanding as well. So it's comforting.
That's good. Yeah, that complete transparency is so important. Yeah,
that's the word I was looking for. Thank you, transparency.
Yeah.
And a question did come through here. Your selection process, what was that like? Was that a formal RFP, or how did you decide?
So we actually had been approached by 2 other companies in addition to you guys. And actually, I think I reached out to you on the recommendation of our CFO, who's familiar with you through the professional organization. But The other company just had a hard sell. I mean, he was calling me every couple of weeks wanting to know if there was any progress. And then the problem with them is they weren't interested in our clinic if the hospital wouldn't come on board as well. So that didn't really meet our needs. And it felt like it was a strong arm that if I wasn't going to be able to talk our CFO into jumping on board, then he couldn't do anything for us. He kept talking about all of the things they're doing everywhere else instead of really what they could exactly do for us. And their costs were higher, their fees were higher as well. So you guys just felt like a good fit from the first time we talked. So hometown business.
Yay.
Nice. All right. Well, I don't see any other questions, so we will move on. And just wanted to let everyone who's attending know that there is a case study. It's not with Minidoka, but it is a similar, it's a critical access hospital also. So if it's something that you're interested in, it is the Turnkey solution. So that it's the same early out white label portal, debt collections, and they also did the consulting piece. So if that's something you're interested in, we'll send that as a follow-up to this webinar so that you have it. We'd love to talk to you further about this turnkey solution. So we will be reaching out just to make sure that all your questions were answered, and want to thank you so much for attending today.
Yes. Brenda, Tammy, thank you so much for joining me and Lisa today. We appreciate it. And for all those who are online, also appreciate you. And may the force be with us all, right?
Thank you.
Thanks, Brenda. Thanks, Tammy.
Thank you.
Thank you.